Thank you so much for having us today. It's been such an amazing and valuable experience working with HPSN, hearing your stories, and learning the importance of keeping organizations like this in our toolbox. I know we were all inspired by your strength, resilience, and beautiful sense of community. Now to start, we have a presentation on emergency preparedness by Asbaa and Graham.
Hi, thank you. So my name is Asbaa, and we're going through emergency preparedness with Hermansky-Pudlak Syndrome. To get started, what is emergency preparedness? So it's not just being prepared before, during, and after. Emergency preparedness is planning before, during, and after a natural disaster. It's about keeping you and your loved ones safe, not only during the scary moments that this natural disaster is happening, but also after, when you don't have any power, electricity, resources, you don't have care, like you don't have access to medical care, and you don't have access to call for help. And so it's about who and what is your support system, and what you can do to keep yourself safe. So why do you need to plan? Well, natural disaster can strike at any time. So it can be a fire, it could be an earthquake, or it can even be a storm that turns at the last minute. So it's really important that you plan ahead of time. So you need to make sure that every single person in your family knows that what you're going to do and is aware of your plan. And because, again, you can lose access to a lot of resources. So how do you prepare for emergency? So you're going to build a kit. This is something that Liv and Andrew are going to go through into more detail. But for regularly, you're going to collect like food, water, and clothing and items that you need on a daily basis. But with Hermansky-Pudlak Syndrome, now you're going to think about life-sustaining equipment. So here's some stuff that you need in your kit, again, which Liv and Andrew are going to go into more detail. But one of those things is that what you need is like medication. So here's a list of medication, and again, you're going to be more familiar with this list of medication than any of us are going to be. And so it's really important that you have access to this medication. So that means like being prepared beforehand. So a lot of these times you're not going to know when an emergency strikes, but sometimes if a hurricane is happening, then you have an awareness that something bad is going to strike. So that means calling your doctor, your pharmacy, and your insurance to get the extra medication. I know that is a very frustrating process, especially when we were going back to that previous slide with that long list of medications. And also another thing that you need to think about is how to store that medication, because a lot of the time it needs to be kept cool. So maybe think about getting a cooler in order to store your medication. And so another thing is communication. So this is having your QR code near you and your insurance card in hand. And it also means reaching out to law enforcement so they know about your needs when you know ahead of time, or even maybe if you don't know ahead of time and you know that you live in an area that has like earthquakes, for example, just letting them know to think about you during those times. And so if also having someone in your support system that doesn't live in the same area as you can be a huge help, because they can keep an eye on you or let people be aware where you are when a natural disaster happens.
Hi, I'm Graham. I'm another first-year student. So yeah, touching on some of the things Asbaa mentioned, including getting in touch with law enforcement, firefighters, some of the community resources that are going to be available to you, but also making sure you have a network outside of just your immediate household, possibly out of state, that you can get in touch with and becomes a resource for you during this emergency response that we're going to work on together. So first things first, you want to get informed. So that involves making an individual action plan for your household. And in order to do so, you need to know what your community emergency response looks like. So that means you're going to need to know what the emergency action plan is. And normally what you can do is reach out to your local emergency management office. Now, they have a lot of different names, but they're usually based at the county level. So what you're going to want to do, something that I found very helpful for finding out this information, was just look up your county name, your state, And then local emergency management office, you'll be able to get to their website and start to look up some of these community resources. And those include, like I mentioned, the community disaster plan. You're going to learn about the response plans, evacuation plans, designated emergency areas. You're going to figure out where the routes are going to be, where they might be picking people up, local schools, for example. You're also going to learn about the community warning system. This is how the local government's actually going to get in touch with you. Sometimes, it can be an AM radio station, for example, but it can also be a text system. But just being aware of how you can get the messages that there is a disaster in progress, this is the response, and to, again, act on the community emergency plan. And then finally, there are assistance programs that are going to be available to you in your community that will help you by getting in touch with your police or firefighter department, that are going to help you to evacuate if you need it, provide transportation mainly, but also make sure to check in with you if you have any special needs or requirements. And we'll talk a little bit more about that here. But as all of you know, HPS creates certain difficulties or unique problems to overcome when you're managing an emergency response. So it is very, very vital to get in touch with your local fire department, your local emergency response management office, to get registered usually, or simply be enrolled in those special assistance programs. So the evacuation plan itself. You want to know the best way out of your home in case of an emergency. If you live in an apartment building, for example, or you live in a house that is, might be in a more remote area, knowing how to get out of your house into a safe place is the first step. You also want to set an agreed upon location outside your home, as well as maybe in your neighborhood, that where your family members can meet if lost or separated. This can be a school, this can be a certain intersection, but having somewhere that everybody in the household knows to get to if you're separated, if you're lost, to regroup. So, and again, you also want to try and designate an out-of-town relative or friend or somebody in your circle to be a contact that members in your household, if they get separated, contact, can help be kind of a connection for everybody in your household. Again, if you get separated, just making sure that all your family members should be able to call them to let them know where they are if they get separated. Of course, this goes without saying, grab your emergency kit and get moving. Like I mentioned, moving towards emergency shelters, evacuation routes that you'd learned about from your community management, emergency preparedness office. If using that special assistance program, know how you'll be contacted and be able to contact them. And then stay informed of emergency updates via the designated community communication, again, usually that radio, but just keeping up to date on what's happening. And I think one thing that you should try and do is practice putting this plan into motion. At least once, twice a year, go over it with your family, just have some idea of how you guys would put this thing into action. And make sure to check your emergency kit. There's some stuff in there that you want to make sure is not out of date and doesn't need to be replaced. So, I'll hand it back off to Asbaa. Who's next?
Hello, everyone. My name is Andrew. Thank you so much for having us today. I handed out during the break some paperwork, our checklist that we made in collaboration with Donna. So I'm sure, as many of you know, making a disaster prep kit can be so overwhelming, and there's so many things that you want to bring, things that you forget. So we worked with Donna to, think of some things that could help you prepare. Disaster preparedness is not only practical, but in my case, I think it's very empowering. It helps you get over the anxiety, the stress of a what if scenario. At least you do have a backup prepared. So as you have on your tables and also on the screen here, we went over some categories of some things that you may want to bring, such as food and water, obviously, but first aid, some general things that you may not think of, such as whistles, clothing items, some medical documents that may be necessary as well, and to help fit in everyone is different and everyone has their own unique needs as well that may not be encompassed by this checklist. So on the second page, we included some empty lines that you could write your own things in to make sure to bring, to make sure to have, and make sure to keep updated as well. So yes, this is a growing document. Feel free to contact Donna or any of us for any updates that we miss, because obviously all of us, we only have our limited perspectives, So we would like to hear from you guys and see what else we could add as well. So.
Okay, on to the final part of this document. We just have an emergency action plan. So this goes along with a lot of what was said in the presentation, just kind of having it in written form and just saving this as a document so you have that plan in place. Going through your address, personal information, names of individuals in the household, including pets, of course. We have emergency contact information, the out-of-town contact that Graham and Asbaa talked about, medical information, including primary diagnosis, perhaps your primary care physician, hematologist, pulmonologist, and your pharmacy, as well as the numbers. So those are all written down for you. They also mentioned that medications, of course, might be difficult to obtain in the event of an emergency, so being prepared and reaching out beforehand can definitely be helpful. We have some lists of daily medications, quantities, emergency medications, medical equipment. Of course, this is all personalized to you and your health, so this can be edited. And then emergency situations and action plans, evacuation locations, transportation needs, shelter in place plan, so a designated safe room in the house, where the emergency medical kit location would be, including some of the items we recommended from the list. Oxygen backup if needed, backup power source. And then we have some other needs. This is just an open section where you can consider your daily living needs and plan around that. Just some space for you to think about what you really need. And then here's a small section to create an outline of your home, identify escape routes, safe places, fire extinguisher locations, major supplies, and important points. And of course, remember to keep this document in a safe place and update it regularly. I apologize, we're a little short on the documents. I think there are just 2 at the table. But yeah, I think that's about it. I think it's going to become available on the website soon. Double check that. But yeah, does anyone have any questions or anything about these documents or the presentation? Okay, awesome. Well, thank you guys so much. We really appreciate being here again.